security has to be on the forefront. It has to get to the place where every decision we're making is keeping security in mind. HIPAA compliant is there for a reason. It's not meant to be restrictive. It's meant to be protective.
Hey guys, it's Kyle, your admin for the Dental Office Manager community. We are on right now with Debi Carr, and Debi Carr is one of our members in the community who has been super helpful, super insightful, and a trusted resource for all things IT. So Debi, it's a pleasure to have you on. I'm so happy that you joined us, and I would love to introduce you to our community members.
Well, thank you for having me. Let me just give you a little bit about background about myself. Yeah. I was a practice manager for 25 years, so I have been in the office manager space. I know exactly what office managers are going through and how they wear so many hats. And so I completely understand how all that works. But about 10 years ago, actually, in 2014, I went out on my own and started working with doctors to implement cybersecurity in their practices, because I realized then that there had been changes to HIPAA. Through the years, we've had additional changes, and so it is my passion to help practices to implement cybersecurity so that they'll meet HIPAA, but they'll also protect their doctors and their patient, because as an office manager, we're always looking out to protect our doctors. And right. So that's my passion, is to help protect that investment that the doctor and the office manager has in their practice.
Yeah, that's wonderful. That's one of the leading concerns right now with all the cyber attacks that have been going on. As an office manager myself, I'm kind of like, well, hey, what is it that we should know? And a lot of the members have kind of been in the dark, including myself, because we're here about the cyber attacks, but more so, office managers may be concerned with insurance checks not coming in, and cash flow disruptions. But it's almost kind of like there might be a bigger picture here that we should be looking out for.
Oh, absolutely. There's a bigger picture, because I get that it is frustrating and aggravating that claims are not coming out, and that we're having to, pivot from Change Health over to Vine, or to another e-prescribing iCor Connect, whatever you choose to do. I highly recommend that you not wait for things to happen with Change Health, because there are OCR, which is the department that oversees HIPAA, has already released several notices that they are already investigating, which is highly, highly unusual. Normally, an investigation into a cyber attack can take years. We're 3 weeks in, and they've already launched an investigation, because this affects so many people, and we don't know the full extent. But what we do know is, in the alert that OCR released, they indicated that practices need to make sure that they are taking their breach notification policies in check, and that they have aligned their HIPAA and cybersecurity compliance. And a lot of times practices don't understand. They think their IT is doing all this. IT takes care of your information technology, the black boxes in your practice that that you turn on every morning. I handle or work with all of the data, because just because it doesn't stay in that black box. You and I can have a conversation about a patient. That is data being transferred. So how do we do all this? So cybersecurity is basically an umbrella that oversees everything that's happening in the practice. So what OCR is saying is that practices need to make sure that they are HIPAA compliant. So have they done a risk analysis? Every practice is required to do a periodic risk analysis, but there's a lot involved with that before you can even get there.
Hmm.
Of course, you want to make sure that you're documenting your annual training, but you should also have a written security manual. Most practices that I encounter have never done a risk analysis and do not have a security manual because, and IT can't tell you how to levy sanctions when people don't follow the rules, how to hire, how to fire, how to release records when somebody requests those records. These are all protocols that need to be created and established within the practice.
Interesting. So what you're saying is IT support from a company who handles IT, such as the hardware and kind of just helping us maintain and keep things updated. That's just like one aspect of a solution.
A critical piece of the pie,
Okay,
so to speak.
got it.
And I highly, highly recommend that everyone have a MSP, a managed service provider, someone who is managing your firewalls because HIPAA 164308D, 1D says you have a mechanism in place for monitoring network activity.
Hmm.
The average practice cannot monitor network activity. There are so many things that are involved with that. And as cyber attacks have gotten more aggressive, more sophisticated, those tools have to get more aggressive and more sophisticated. So you need to have that managed service. And I always cringe when I see a Facebook, how much do you think we should be paying for our IT? Well,
Hmm.
it's a valuable piece of your pie here because I can tell you the average cost of a cyber attack, um, just forensic alone, is going to be 50 to 75,000. If you have
Wow.
to notify, I've got a practice right now that is well over $500,000 in a cyber attack. They did not have any cyber insurance to help offset that. So they've had to borrow money. Both the doctors have borrowed money from their 401k to pay for notifying all their patients and restoration. And they lost data because they thought that the backups were happening. The backups were corrupted. So it's layers of security and redundancy that our practices are just taking for granted and not doing.
So it sounds kind of like what you do is kind of like you're at the forefront and you kind of like say, hey, look, let me analyze what your IT is even doing for you.
Not
Is that
just your IT, because it's not just your IT. Yes, I want to know that they're doing what they say they're doing because a lot of times they're not. But
got it?
also, what protocols do you have in your practice that are security risks? For example, I was in a practice and the office manager went to lunch. Okay. She left her desk open, her office open, and on her desk was everybody's payroll with people going in and out. She did not see anything wrong with this. The doctor didn't see anything wrong with this. I saw a lot of things wrong with this. This is just simple things. A lot of times I'll see where there's a door going from the reception area into the clinical area, but we always leave the door open. But that's a security risk. There's a reason why that door is there. We want that door closed because, believe it or not, we don't live in a good world anymore. And that door being closed could buy 5 seconds of a threat actor or an active shooter getting back to clinical. So
Yeah.
it's just knowing these things and having the training to know and to look at things from an independent view. A lot of times we think it's okay, so it must be okay. But having that independent view of what is could be a security risk is what I
Yeah.
do.
Yeah, that's amazing. I never really thought of it that way where it's like, as an office manager over the years, I just kind of said like, hey, look, I'm not really like I'm doing a lot of things. I'm doing the
Right?
insurance, I'm focusing on patient education, treatment planning, case presentation. And so
Employees,
yeah, the list goes on, right? So
juggling hats.
exactly. So it's kind of like, I'm not thinking like, hey, look, maybe we should hire someone to come in here to the office and help take care of these things that are obviously important to any dental practice. And
Well,
so,
and it's the first step in HIPAA compliance. So
Mm.
when you look at the HIPAA security rule, HIPAA has 3 areas. It has a privacy rule, which everyone is really good about. Don't talk about your patients in the waiting room. Don't talk about your patients outside of the office. We know this. But the security rule is where practices fail. And it's the fact that they're failing is why OCR now is getting aggressive in going after these practices, because we've had the security rule since 2003. Here we are 20 years later, and they're now starting to enforce it. But when
Mm.
you look at the security rule, the very first protocol, the very first item is to conduct a risk analysis. Yet practices haven't done that. They don't even know that they need to.
I've never heard of it.
And you're not alone. That's because a lot of the information out there is concentrated on the privacy rule. And that's where the emphasis has always been, keeping your patient privacy secure. But as we've seen these attacks literally since 2020, we've seen these attacks become more aggressive, more sophisticated. We've seen 4 different, between laws being coming out and executive orders coming out, attacking or emphasizing cybersecurity. Just 2 weeks ago, just before the Change Healthcare cyber attack happened, OCR released a new guidance for HIPAA compliance for the security rule. They've already applied 3, just in the last 2 months. They've already applied 3 fines, and these fines are not cheap. These fines are steep. The first one was $450,000.
Wow.
The second one was 4.5. The 4.5 I'm dismissing because it's a hospital, and you know what? They deserve it. But 450,000 for a practice is a lot of money.
That is.
And to make matters worse, there are certain states that are also starting to levy those fines. State of New York, I believe you are in New York or New Jersey up there. The state of New York just levied a fine against a practice for 450,000 because they had a cyber attack that impacted their residents' information, because all 50 states now have laws that protect the residents. I'm in Florida. We have a lot of people that come down here and visit and see doctors while they're here. And it's not where they live when you see them, it's where they live when the data breach happens.
Oh my gosh. Wow. This is important stuff. I think dental practices really need to start protecting themselves. It's kind of scary because, there's a lot of different things going on, right? And we don't necessarily hear about them because, again, it goes back to we're busy running an office, right?
Right.
But in terms of what office managers can do to start, what would you recommend?
Start with looking at getting a risk analysis,
Okay.
because that is what when there's any kind of data breach, and OCR is already hinting that every practice is going to have to be report. Now, I don't know, I don't believe that they're going to investigate every practice, and the reason why is because this is not just dentistry that was affected. This is all spectrums of healthcare that were affected. So I believe that what they will do is they will do what they did in 2014 when the Anthem Blue Cross cyber attack happened. They did a sampling. How do you know if you're going to be in that sampling? You don't. This is one of the few times that I would tell a dentist. Normally, I would say most dentists are not Medicare providers, right? So most dentists are not apt to be a random audit because we're not Medicare providers. That just changed. This data breach has changed that spectrum. And so there is a very good possibility that they're going to say, okay, we're going to take X amount of dentists, X amount of optometrists, X amount of cardiologists, X amount of hospitals, and just do random audits. So the first step would be that Practices need to be familiarizing themselves with this security rule. And I'm happy to provide that information. As you know, I want to help practices and I'm always available to answer any questions. They have hinted that practices should be notifying their patients. Now, how do we do that? You're supposed to have a policy in place. Most practices don't. Most practices don't have a plan to respond to a cyber attack. I will tell you that, and that is also required under HIPAA. How would you respond to a cyber attack? Don't shut down your computers. I know the first instinct is to shut down the computer. Don't. You unplug it from the internet and you leave it. You can call your IT in, let them diagnose that, yeah, it's a cyber attack, but don't let them do anything else because we have a crime scene. And it's important that you go through the steps to determine who, what, when, where, how, which is under the HIPAA breach notification. Remember, there's 3 areas: privacy, security, and breach notification. So there's a lot of rules that dentist offices, for some reason, have basically, I don't know, put their head in the sand and said it doesn't apply to me. But those days are gone. They're not accepting that excuse anymore. And so dental practices, patients trust us to take care of their information. They're giving it to us and we're establishing that trust relationship. So I came out of perio. So when my doctor says you have a bacterial infection and we need to do osseous surgery, that patient, because they trust us, is going to trust that diagnosis. When a cyber attack happens, that trust is violated.
Yeah. Yeah, I could definitely see that a patient would, at the very least, lose trust in the dental office and, especially with the private, health information, credit cards. I mean, we do handle a lot of delicate, sensitive
The,
information on
the other
patients.
day, I got a call from an office. They're putting the credit card information into the doc center. No, you cannot do that because it's not encrypted. You're supposed to be protecting that information. And who has access to that? Everybody in the practice. It should be on a need to know. Oh, that goes back to HIPAA. If you're implementing HIPAA correctly, and I'm kind of HIPAA on steroids because the guidance that came out 2 weeks ago, they I've always, since I started working with my clients in 2014, because I pivoted to cybersecurity, I used a framework called the cybersecurity framework with my clients. That's what they came out and said 2 weeks ago. Here's a framework, the cybersecurity framework that you can use. We all need guides. I'm good at implementing things if you tell me what I need to do. That tells us what you need to do. Every practice should have a master inventory list of all your devices, but also all your applications, and have a process for when you're no longer using that technology. The data breach I'm dealing with right now, they stopped using the vendor 6 months ago, but TeamViewer was left on the practice, on the information system. And guess how the hackers got in? The road TeamViewer. So it's having these processes in place and instead of putting HIPAA on the back burner and saying, oh, oh my goodness, I cringe. Who can do our HIPAA training? Oh, we'll just have Stericycle. It's like, what?
Yeah. Yes.
HIPAA is much more than annual HIPAA training. Technically, every practice should have a security policy, security manual, and they should be training on those policies on a regular basis. Don't post your passwords, have complex passwords. Are you using unique user into the information system, not just into your practice management? Because I guarantee you there's so many practices that are using a global credentials to get into the computers, but everybody has unique user to Dentrix or Eaglesoft. That's not what the law says. It says to the information system, because there's a lot of technology in there where patient information is. that maybe other people shouldn't see. And user activity is to be monitored under HIPAA. If you look at 164312, user activity to be monitored through unique credentials. So
Hmm.
if your office is using global, everybody's using operatory one, DOC for their password, that is not compliant.
Hmm.
And shame on the IT for letting that happen.
Yeah, yeah. Yeah, I could see how this could be an issue. Or I can see how practices could easily, just look this over and then when the issue comes up and something actually happens, it's kind of like, uh-oh, what are we going to do? We have to scramble to find a solution. So Debbie, my question to you is, what is it that you can offer members of the community besides what you're already offering in terms of providing valuable information on posts that are coming up in the group, which we really do appreciate. We love the information you're giving. You have been so helpful so far, especially for me. I've learned a lot in our last meeting. We jumped on Zoom. We had a great discussion. Um, that's why I said, hey, look, let's get you on a webinar and let's really spotlight you as a member of the community and hope that we can have you contribute further in the community to help the members. But my question is for you, Debbie, what is it that practices should be doing, and how can they contact you for your expertise and guidance?
Well, they can always contact me through your page. They can message me. If they want to reach out through email, they can. My email is Debi at DKCARR.com. Or my phone number is DKCARR1 844 DKCARR1.
Okay.
So I'm always available for a phone call. And if I can't talk to you right then, I'll get your number and I'll call you back because I know what it's like to try to do the balancing act. I did it.
Hmm.
I when I first went into dentistry, what the heck was a subepithelial connective tissue graft? I mean, I knew
Yeah.
nothing about dentistry. You count teeth? What's that? But I knew how to run a business. But now I know we're juggling a lot, but security has to be on the forefront. It has to get to the place where every decision we're making is keeping security in mind because all it takes is one unintentional action that can take down. I just was in a class last week where it was a hospital involved, and the hospital was down for 23 days. And all it was a employee had just left HR because she was doing her exit interview. She was getting married and moving to Portland. And she came back to her desk and there was an email about the new bonus structure. Click. Ransomware went through the system and they were down 23 days. This is a regional hospital. That's how fast it can happen. I had it happen in my practice. I was actually getting ready to go leave the office for the day, and the our DA said that there was something wrong with the computer. I went back and realized that a virus was traveling through. I literally kicked off my heels and was running through the office trying to unplug all the devices to try to isolate it so that it wouldn't take out our server because it did start and back. Unfortunately, I didn't make it. I was able to save 3 workstations, but not our server. And this was back in 2013, 2012, when before all the sophistication happened. So can you imagine where we are now? And so it's important that we as office managers change our mindset, that we have to get security minded. HIPAA compliant is there for a reason. It's not meant to be restrictive, it's meant to be protective. And that's what we need to do is change our mindset and start putting our patient information. Because I can tell you, when a data breach happens, it is an emotional roller coaster, not to mention the financial and reputational damage.
Yeah, I appreciate the energy. I'm feeling the emotional roller coaster right now. So, it's definitely, I mean, you've brought a lot of information that is I'm going to run back to my practice now and actually,
Look at that security manual.
yeah, we're going to get started on things right now.
So
Um,
the first policy, everybody should have a security manual. The first policies should be an acceptable use policy. What employees can do or not do with the systems. And if it's not in writing, it did not happen, right? So you can say, well, we've always said that our computers were not used for personal. Is it in writing? Did you train on it? Can you document that you did all that? Then it didn't happen. So it's important that we start running our dental practices as the businesses that we are, and that we start taking security seriously and stop putting it on the back burner, pawning it off on our IT because they only have 12 requirements. There's 152 with a bunch of subs on the practice itself.
wow.
And with this Change Health, there's a good chance that we're going to start seeing some audits come down the pike.
Hmm. Yeah, that gets me worried. So
It should.
definitely in terms of in terms of getting things started, right? It sounds like it's a lot of work. Like for an office manager to say, "Hey, look, I have to have this document. I have to create this plan. I have to, it's a lot of like I have to, right?"
Yeah. One more
So
thing on my hat.
yeah, exactly. So it sounds like, you really take that off of our hands.
I won't do it for you because the policies have to be specific to your practice.
Nice.
So how I do things in my practice is going to probably be different. I have doctors that they want to see every record request come through. I have doctors that say, just get it. If they want to go, go. And that is the way it should be. When a patient requests their records or when another provider requests their records, the records should be sent as quickly as possible. And especially going provider to provider, that is continuity of care. So release those x-rays and stop hoarding them and stop making the patient come in and sign a form. That's not acceptable. Verify that the patient is going to be seen in that office and release their records. But it's important that that practices start having those things in writing and start training on those and have those processes down.
So that's where you come in.
Yes, I help you with doing that. I'm actually putting together, I have a workshop and I'm actually trying to get a date and location for that, where we can, it's as security officers' requirements of what they should have in place, what a security officer's responsibilities are, and what policies and procedures. So I will be happy to let y'all know when I'm going to be doing that. We are talking about maybe even doing it online, so over a period of lunch and learns.
That
Because
sounds
it's
awesome.
normally a 2-day event.
I can imagine. It sounds like a lot to digest right now. So
It is. It
having
is.
you on the team can make things a lot easier. So I'm definitely interested in learning when that webinar or when the workshop will take place. Because I'm sure just like, other office managers, myself, we can learn a lot from this from your experience.
And we need to learn a lot from Change Health too. We need to make sure that, we have the right protocols in place because it can happen to anyone. And I've actually had doctors tell me, well, everybody knows ransomware only happens to hospitals. Dentists are low-hanging fruit because they know that hackers know that they don't have the right protocols in place. But think about this. When you hit a dental office, you get all the demographic information, right? Because we take all that. We have their oral health history. We have their dental insurance. But wait, we have certain procedures now that have to be filed to medical. So now we need their medical insurance card, right? Oh, we also take their medical health history. I can recreate an entire person with the information that is contained in a dental practice. Your cardiologist is not asking you, they may ask you, have you been to the dentist lately? But they're not asking you for any details. We're taking your blood pressure.
No.
So I can recreate an entire person in the practice with that information. So, and that information right now is very, very, very valuable.
It sounds like we really need to take the steps to protect our patients' information.
And your doctor's investment. Because if this cyber attack is devastating. And a lot of times they just say, I'm done. So, you're protecting not only your doctor, which as an office manager, we're always doing, right? But you're protecting yourself because you're protecting your job.
Debbie, you have given me a different look on cybersecurity in dental practice. So
Good.
I'm sure everyone here that's watching is going to feel the exact same way. So Debbie, I really appreciate you coming on here and really enlightening me and allowing me to share this information with members of the community. We appreciate you as a member as well. And you have provided so much insight that I thank you from the bottom of my heart. What I would like to do is share your contact info in the comments. That way, if any members of the community have any questions or need some guidance and help, they'll be able to reach out to you directly. And I think that would be helpful for everyone.
Sounds good.